Millions of Obamacare consumers have found health insurance more affordable in the last few years, thanks to generous federal aid. Now, that help is up in the air.
5 weeks into the federal shutdown, Congress isn't any closer to an agreement.
The sides are entrenched as the shutdown continues.
The standstill
and the White
comes
House
down to one key issue.
Republicans and Democrats remain deadlocked over expiring health care subsidies under the Affordable Care Act.
Unless Congress takes action, subsidies will drop next year, and shoppers will see their monthly bills more than double on average. Consumers will now need even more help finding a plan, but there's less help available. In about half of the country, Obamacare Navigator programs are federally funded, and the Trump administration has cut that funding by 90%. Today, we talk with one of West Virginia's remaining navigators about what's at stake as consumers shop during this year's upheaval.
There's a lot of paths that somebody can go down that makes this hard on them and their family, which is why we're even here in the first place.
From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. Jeremy Smith is program director for the West Virginia Navigator program operated by First Choice Services, a nonprofit based in the state's capital, Charleston. Jeremy, when you're at like the family gathering and your great aunt or your great uncle comes up to you and goes, Jeremy, what is it you do again? What's your answer?
My family still doesn't know what I do. It's complicated. It really is hard to explain what we're doing. And until somebody has sat down with one of us and we work with them for an hour straight to get them through all this, they really don't exactly know.
Formally, a navigator is a job created by the ACA to help consumers find a plan. Unlike brokers, navigators can't be paid by insurers. In his role, Jeremy's learned the ins and outs of insurance. He's gotten steeped in marketplace rules. He's also traveled the state, promoting coverage at festivals, churches, and community centers out in the coal towns of McDowell County, where his grandfather was born, and the mountain resorts of Pocahontas County.
I remember driving through there at one point and just kind of pulling off the road and just literally getting out of the car and just looking around and thinking, my God, like I've lived in West Virginia my whole life, but this is blowing my mind.
Now, Jeremy knows buying your own health plan is complicated and deeply personal. He spends an hour or more helping someone sort through their healthcare needs, budget, and insurance options.
I've got people that ask for me every year now, and that's the same way with all my staff too. After they've helped somebody, you're kind of bonded for life.
Jeremy has been super busy the last few years. People have flocked to the Obamacare markets after Congress temporarily boosted subsidies for consumers to pay for premiums. Jeremy and his team have seen a 4-fold increase in people who want their help, from about 500 before the larger subsidies to around 2,000 last year. Normally, in the fall, he's on the road, getting the word out and signing people up. Some have never had insurance before. One woman sticks in his mind.
2 years ago, a lady came in and she sat down and told a couple of us, she said, y'all may not remember me, but I came in last year and you helped me sign up for health coverage. And little did I know I had breast cancer. Because after I got my insurance, I went and got checked. They told me if I'd waited any longer, I may not be here. And she kind of started tearing up, and she was just so thankful. She admitted that if she hadn't have picked up the insurance, she never would have went and got the checkup and probably never would have found that cancer.
When she started to tear up, did you start to tear up?
Oh, yeah, everybody did. It just kind of reminds you that if people don't have health coverage, how catastrophic it is. My own parents both benefited at one time or another from either the expanded Medicaid or the marketplace plans. And, you know, they was going through hard times in their life. Cancer diagnosis and job loss, and it makes you feel good that you can be a solution to the problem, that you can help people get where they need to
Getting people where they need to be is going to be tougher this year, maybe a lot tougher. First, Jeremy's staff is much smaller. The Trump administration cut funding for navigators in the some 24 states with federally run marketplaces from $100 million down to $10 million. In West Virginia, Jeremy's employer, First Choice, closed 4 of its 5 Navigator offices. The nonprofit had more than a dozen navigators in the state, but after the cut, only had federal funding for 1. The White House said navigators enroll too few people to justify all of that spending. So, Jeremy, why in your mind was this money well spent?
Well, health insurance programs are so complicated. You almost have to sit down with somebody you can trust in order to understand it and get signed up into the right thing. Navigators tend to help among the most vulnerable populations in our society. Folks that have a hard time using a computer and can't do the healthcare.gov website themselves. People that have either low literacy rates in general or just low health insurance literacy.
Jeremy added that money goes for outreach. That's how people who just lost their jobs or aged off their parents' insurance learned about ACA plans. And he said navigators also promote and enroll people in Medicaid and other safety net insurance. Jeremy absorbed the blow of the White House funding cuts and started knocking on doors. He ended up raising enough money to hold on to 3 of his coworkers. In late October, a week before open enrollment, I asked him how he felt about his smaller team.
We're going to see what we can do to still give as much help as we can to people, but we know it won't be of the same caliber or capacity as we're used to. I mean, my worst nightmare is we come in and we work all day, and then at the end of the day, there's still 20 voicemails sitting of people that we haven't been able to get called back.
Jeremy and his condensed team themselves can only do so much. So this year they plan to refer people to safety net clinics called federally qualified health centers that also help people enroll for coverage and direct folks to a step-by-step guide that First Choice created for anyone who wants to try to do it on their own. To maximize their reach, the crew of 4 will do all of their navigation by phone this year. Is this the first year that you won't be going out to Pocahontas, that you won't be going out to McDowell?
Yeah, probably so. We've got to do what we can to be as efficient as possible and spend what money we have in the best way to still help as many people.
What do you lose by not going to McDowell? I don't mean you personally, but what in terms of the service, what do the people in McDowell lose because you're not going to be there?
There's a lot of people that kind of only trust who they can sit down with and meet face to face. So we lose that. We lose some of that trust by not being able to go onto their home turf and spend some time meeting them where they're comfortable. So that's a trade-off that will hurt some folks. We know it will.
When we come back, open enrollment begins as Congress remains deadlocked on more generous subsidies. We also hear from Jeremy about questions and reactions he's getting as West Virginians start shopping for health insurance. Welcome back. We're talking with Jeremy Smith, who has helped customers shop for insurance in the Obamacare markets for more than a decade. Jeremy has worked for months to prepare for this moment, knowing this year would be tough. We caught up with Jeremy at the end of the day after West Virginia's marketplace had just opened. Hey, Jeremy.
Hey, Dan. How you doing?
How was day one of the new open enrollment season?
Chaotic and a mix of emotions and frustration, and it was a lot, but it still wasn't even what I thought it would be, so I don't know.
Jeremy told me his day started with black coffee and apprehension. He soon jumped in to take some calls and kept an eye on voicemails to see if his small staff was getting swamped. Around 11, an ACA shopper, one of their regulars, showed up.
He said he didn't do computers, didn't love doing stuff over the phone, and he just, he prefers it this way.
This is exactly the consumer that Navigators are there to help. The man knew the drill, brought his folder with details of his plan and income. Jeremy punched it all into the computer. Turned out the man's monthly premiums were only going up $10.
He was happy. We were pleasantly surprised that he didn't have a huge premium increase. I mean, $10, $20, $50, which is still an increase for people, but it's nothing like we thought maybe could happen.
After that moment of sunshine, Jeremy next spoke by phone with a shopper who learned her plan would go from $200 a month to $800.
I think that they were completely in shock about the possible rate increases. They didn't know about it. They hadn't expected it. So the good thing about this job is usually everybody's pretty happy just because you're giving them so much effort to help them through this complicated process. So it's been several years since we've had a lot of the consumers that we help kind of get irritated and upset. And, money does that, right? If you're having to pay more than you think something's worth, it's a justifiable reaction to kind of get curt and upset with somebody, even if they're trying to help you.
Her costs went up so much, says Jeremy, because the enhanced ACA subsidies as of January are going away. And when you told her that, what'd she say?
Not a lot, just, okay, let's do the application. And then when we get to the end part and start going over the plans, it's pretty quickly, well, I can't afford that. We don't know what we're doing, and so we're not showing them the right price. So it was just an initial reaction from them of just being frustrated and just kind of saying, forget it, I'm just going without insurance then, and then kind of being like, we're done here.
We're done here, click?
Yeah, kind of like, don't proceed, we're done. We can't afford this, we're not doing this.
Calls and tough conversations continued as the day went on.
A lot of those folks were experiencing what we've been calling the subsidy cliff.
Right. When the subsidies get smaller next year, some people will no longer be eligible for any aid. These are middle-income households, those who earn more than 400% of the federal poverty level.
I think one poor person for a catastrophic plan was going to be $1,500 a month.
A catastrophic plan was going to be $1,500 a month.
Yeah.
These are plans with very high deductibles, right? I think like over $10,000 for an individual, more than $20,000 for a family.
Yeah. And so at that point, they were like, nope, sorry, let's end this conversation. I can't even come up with that. I'm going to check back in with you in December and see if that's still the case.
Actually, a bunch of ACA shoppers told Jeremy and his colleagues they planned to wait, hoping Congress would eventually vote to deliver higher subsidies. A little relief at the end of the day. There was no backlog of unanswered calls that Jeremy had feared, but he almost blames himself for why they only got some 50 calls on day one.
I was scared to death that we wouldn't be able to meet demand. Most years I'm traveling all over the state doing media interviews to promote open enrollment. I didn't do that this year. I think I maybe talked to one local TV station, whereas normally my October 31st every year is talking to 8 or 10 TV stations across the state, 3 or 4 newspapers, going on radio shows. We're usually doing paid advertising, posting on social media, and we're doing videos on social media. So we're really pushing hard to make sure that the public knows about open enrollment. And we didn't do that this year. I just knew that if I promoted it too hard and we had 50 voicemails sitting there and we couldn't even call them back, what good does that do either? So it was a big difference this year. And I feel like we handled the call volume, but it wasn't nothing like it used to be.
Beyond the smaller subsidies, another change this year, consumers inadvertently could end up owing the federal government money. To get financial assistance, shoppers must estimate next year's income But if they underestimate due to a job change, a bonus, whatever, folks could get an unwelcome surprise at tax time. Before Republicans passed the big, beautiful bill, this so-called clawback was capped. That cap is now gone.
Yeah, I'm worried about it. People are not wired when it comes to health care to think about this. They're used to being one and done. So we've added a step in our process that when we sign somebody up, we're going to email them a form that they will have to click and sign that says that they agree this is the income they wanted to use. And big red letters, it's going to remind them about the tax ramifications. And hopefully that will help kind of make sure that this gets in people's heads, how important this is and how much of a liability this can be if you get it wrong.
When you get to the end of open enrollment this year, what's your best case scenario?
I think if we can even help half or 3/4 of the people that we had been helping, I'll be blown away.
It's been your job for years to sit across from people where they live and work, hear their stories, help them with decisions that could have profound consequences for their health and finances. Thinking about that lady who came back in with the breast cancer. Great example. Jeremy, as you think about open enrollment this year, what do the policy changes mean for these people that you have met?
To me, and understanding how important health coverage is to somebody's well-being, their livelihood, I can't quite wrap my head around trying to make it harder on people rather than easier. To me, people can't go without health coverage. I mean, if you don't have health coverage in this country, one illness, one surgery, one car wreck can bankrupt you and your family. You have to have health coverage because the cost of getting medical care is just too high without it. So to me, it just seems like everybody needs good quality health coverage, and why make it harder on people?
Thanks for taking the time to talk to us on Tradeoffs, Jeremy. Appreciate it.
Yeah, thanks for having me.
I'm Dan Gorenstein. This is Tradeoffs. Medicare's open enrollment season is also in full swing.
Yeah, so I'm looking at the plan, the Part D plans. Let's see, what is this? Okay.
The one window each year when all 70 million people on Medicare can change their coverage, including for prescription drugs.
You put your zip code in, you put all your medicines in, and try to find other plans.
But this year, fewer plan choices and higher costs are putting some seniors in a bind.
Do you take your drugs, or do you go get groceries to eat? What do you do?
That's next time on Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producer Melanie Evans, senior producer Leslie Walker, editor Deborah Franklin, managing editor Ryan Levy, executive director Jessica Silverman, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Additional thanks to Sabrina Corlett, Jared Orteliza, and Rhonda Ragambe. Thanks also to all our listeners who helped to support our work, including Jennifer Thompson, Dan Diamond, Charles Hebner, Chris Viacio, and Holly Cummings. Our media partner is Side Effects Public Media, based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.